How does raw inflammation affect your heart? Have you ever wondered how rheumatoid arthritis, or RA, impacts your heart? This condition is more than just joint pain. It can lead to serious heart issues due to chronic inflammation. Let's explore how this happens. Rheumatoid arthritis causes ongoing systemic inflammation that significantly raises the risk of heart disease and heart failure. One of the key players in this process is inflammation itself. In RA, inflammatory substances known as cytokines not only damage joints but also affect blood vessels. This inflammation can lead to plaque buildup in arteries, a condition called atherosclerosis. When arteries narrow, blood flow is restricted, increasing the risk of heart attacks and strokes. People with RA face about 1.5 to 2 times the risk of developing coronary artery disease compared to those without the condition. This risk is comparable to, or even greater than that seen in diabetes. Interestingly, this elevated risk can begin even before RA is officially diagnosed, suggesting that inflammation plays a role early on. Moreover, individuals with RA have roughly double the risk of heart failure. Heart failure occurs when the heart struggles to pump blood effectively. This is often linked to systemic inflammation, which can alter how the heart muscle functions. A specific type of dysfunction called diastolic dysfunction, where the heart has trouble relaxing, is common in RA patients. Inflammation markers, like C-reactive protein, are associated with a higher risk of heart failure in these individuals. RA patients often have other traditional cardiovascular risk factors, such as high blood pressure, obesity, and diabetes. These factors can be exacerbated by RA medications, like steroids and non-steroidal anti-inflammatory drugs, and by reduced physical activity. Additionally, the arteries of RA patients may become less elastic, further raising blood pressure and cardiovascular risk. Inflammation also plays a role in making arterial plaque unstable. Inflammatory cells can infiltrate blood vessel walls, producing cytokines that not only contribute to plaque buildup but also increase the likelihood of plaque rupture. When plaques rupture, they can trigger acute cardiac events, such as heart attacks. RA is also linked to other vascular problems, including cerebrovascular disease, which can lead to strokes, peripheral vascular disease, and blood clots. These risks are likely tied to the systemic inflammation associated with RA. So, what can be done? Effectively managing RA inflammation with disease-modifying therapies may help lower the risk of heart disease. For instance, using methotrexate has been associated with a reduced risk of heart failure in RA patients. Regular cardiovascular screenings and controlling traditional risk factors like blood pressure and cholesterol are essential for those with RA. Incorporating lifestyle changes, such as regular exercise, a balanced diet, and quitting smoking, can also significantly benefit heart health. In summary, RA inflammation affects the heart by promoting plaque buildup in arteries, increasing blood pressure, impairing heart muscle function, and raising the risk of heart attacks and heart failure. This highlights the importance of comprehensive care that addresses both joint and heart health. Remember, if you have concerns about your heart health, consulting a healthcare professional is always a wise choice.